Today I'm talking about a topic about the location of lymph node metastasis as a prognostic factor in esophageal cancer after surgery. Okay, so we know the lymph node metastasis status is an important prognostic factor in patients with esophageal cancer, and the distribution of lymph node metastasis depends on the tumor characteristics like tumor's location, its histology, and the invasion depth, and if a patient received neoadjuvant treatment or not. And the affected lymph node numbers also affected the long-term survival. So the treatment strategy would depend on the nodal metastasis status. And so we want to know the relationship between the location of lymph node metastasis and the long-term outcome. We collected data from 2014 to 2019 in National Taiwan University Hospital. And a total 98 patients with esophageal cancer receiving the esophagectomy with 3-field lymph node dissection were enrolled. And 64 patients received the McKeown procedure and 34 patients received Ivor-Lewis procedure. And compare the 2-year overall survival and progression-free survival in patients with and without the lymph node metastasis in the 3-field lymph node, in the 3 lymph node dissection fields, including neck, chest, and perigastric. Okay, here's our result. It's a multivariate analysis, including the age, the gender, the clinical end stage, the preoperative CCRT and the postoperative CCRT, the operative method, and the lymph node metastatic location, including chest, neck, and perigastric. Okay, let's see the clinical stage. The clinical end stage the survival and the recurrence would have the survival and recurrence rate were both influenced by the clinical end stage. And if the patient needs postoperative CCRT, the survival would be worse. And there's no survival or recurrence difference between the 2 operative methods. And it seems the patients with perigastric lymph node metastasis had worse the survival and maybe higher the recurrence rate. Okay, the total 98 patients, the overall 2-year survival was 34.7%. And the 2-year progression-free survival was 26.3%. And here's the table show the location of lymph node metastasis. And 17% with neck, and 46% with chest, and 29 patients with perigastric lymph node metastasis. And for the patients with neck lymph node metastasis, the 2-year overall survival was 28%. And for those without, is 35.9%. It did not have a significant difference. But for the 2-year progression-free survival in patients with neck lymph node metastasis is only 9.4%. It has significant difference compared to those without neck lymph node metastasis. And for those with chest lymph node metastasis, there's no significant difference both in the 2-year overall survival and the 2-year progression-free survival. They both did not have significant difference. And for patients with perigastric lymph node metastasis, the 2-year overall survival is 12.9%. And for those without is 42.1%. It has significant difference. And about the 2-year progression-free survival, the patients with perigastric lymph node metastasis is 14.4%, and for those without is 31.3%. It did not achieve a significant difference, but maybe the patients with perigastric lymph node metastasis really have poor progression-free survival. So here's a conclusion. For those patients with perigastric lymph node metastasis with poor overall survival, and for those with neck lymph node metastasis, that's poor progression-free survival. It means if the patient with the neck lymph node metastasis, it will with higher the recurrence rate after the surgery. Okay, thank you for your listening.
So any comments from the floor? So did you perform the multi-variable analysis? Because I just see the Kaplan layer and just only present the incident of the recurrence and overall survival, right? But I did not see the hazard ratio on 95% interval. And I'm not sure, did you perform multi-variable analysis?
Yes, but I did not put the tables on.
Okay. And about the table, the result, I noticed that you use chi-square test, right? But actually, the recurrence and survival is a time to event analysis. So I suggest to use a log length test, this time to event analysis more than just only chi-square test. Okay.
Thank you.
So because we just only have one presenter, so I would like to close this section. Thank you very much.